A lot of celebrity moms have given birth at home, including, most recently, model Gisele Bündchen there. But a new report says having a home birth actually triples the risk of infant deaths. So should women be able to choose that option at all? Well, Dr. Joanne Davis is a certified nurse midwife, and Dr. Amy Tuteur is an obstetrician-gynecologist. They are going to join us for a debate. I want to start with you, Dr. Tuteur, because when these celebrities have home births, it makes it seem easy, it makes it seem even glamorous. Yet this new report that looked at 500,000 home births did find that the risk either doubles or triples. You say that you're not surprised to hear the results of this report.
No, I'm not surprised at all. When you look at all the papers published about home birth in the United States, they all show that home birth triples the rate of neonatal death. Even the papers that claim to show that home birth is safe actually show that it triples the rate of neonatal death. And the CDC has been collecting statistics on planned home births in the United States since 2003. And if you look at them, that also shows that home birth triples the rate of neonatal death.
All right, and I want to bring in Dr. Davis because you have delivered more than 1,000 babies at home. You're a certified nurse midwife. Have you seen complications that make you think it's dangerous?
I have not, and there are several safeguards in place that minimize that possibility. First of all, we know and have known since the seminal studies emerged in the early 80s that says the single most important factor that protects mothers and babies in labor and birth is a skilled attendant. And one of the arguments I would make would be that several of these studies have failed extensively to distinguish between planned home birth with a skilled attendant with reasonable and important backup arrangements and a well-prepared and well-screened mother and baby. So differentiating that subgroup has not occurred in these studies, which makes them, in my view, extensively flawed.
Dr. Tuteur, Dr. Davis there makes some very compelling points. Quickly, do you think that it should be the mom's choice whether or not she wants to have a home birth?
Well, every woman has the right to control her own body. It's a woman's choice if she wants to give birth at home. But we always hope that people make informed medical decisions, and you can't be informed if you don't know the risks. And home birth triples the risk of neonatal death. Yep. This particular study, the WAX study, may not be perfect, but it's not the only study. Every single study
we're going to have to
confirms that.
We're going to have to leave it there. Dr. Davis, thank you for making your points about the flaws in this study. Dr. Amy Tuteur, Dr. Joanne Davis, thank you both for coming in with all of the information.
My pleasure.
Thank you.
We have more Fox and Friends for you in just 2 minutes.